Welcome back. Teachers are next in line to receive the COVID-19 jab. There's been a surge of cases in the country, and it looks like they're going to be rolling out specifically for teachers and school workers. But how is this going to work? Dr. Nicholas Crisp from the Health Department joining us this morning. Dr. Crisp, always a pleasure speaking to you. And would it be unfair of me to say that up to now the general vaccine rollout has not gone particularly well, and what we're seeing as far as reports are concerned, it is going to be 600,000 teachers vaccinated in 10 days. Forgive me, it seems a bit optimistic.
Morning, Gareth. Morning to the viewers. I'm not sure where you got the figure of 600,000. That does sound a bit high. But so we do know that in that sector there are somewhere around 580,000 people. So I suppose that's why people are saying 600,000. Quite a large number have already been vaccinated because they're over 60, and some of them were vaccinated because they are health work or they're registered with professional councils in the health sphere like psychologists. And then there are a large number who actually have COVID at the moment, so they won't be vaccinated. And we do anticipate the same sort of hesitancy that we see in the general population, which is 30% or more. So we're not expecting all 600,000 people to arrive for vaccination, but certainly we're hoping at least 400,000 people in that sector are vaccinated. And in the major thrust of the education drive is for a 10-day work period, but there are some parts of some provinces where we know that they have planned to roll over into a third week.
So Dr. Crisp, the J&J vaccines, the 300,000 odd J&J vaccines that we currently have at the moment, all of those being used for teachers, and when would the stopgap for the rest of the education sector be brought into the country? Do we know?
Yes, so the 300,000 doses arrived on Thursday last week. They were cleared during Friday and the weekend, and they were distributed yesterday. So today is the final preparations that the health and education departments are making in each province for the start of the actual vaccination program tomorrow. The remaining vaccines are part of the short expiry date vaccines that Johnson & Johnson had provided after we lost the large bulk of our order due to the FDA ruling, which I'm sure everyone's aware of. And they are due in the country either later this week or early next week.
The rollout itself, the actual administration of the jabs at the vaccination sites, what does that look like? How many are there? Does government have the capacity, or are you calling on the private sector to assist, Dr. Crisp?
Yeah, so Gareth, this sector has, because it's a short time that we've got to work with it, we have got a very deliberate and specific public-run program that is being run by the 9 provincial departments together with their education colleagues. So they have selected sites, many of which were already designated to be Johnson & Johnson vaccine rollout sites, some of which have been converted because when we didn't have the J&J vaccine, they converted them to Pfizer sites. So it's a little bit different from one province to the other, but they will then have those fixed sites, and the education authorities are bringing the education workers and teachers and so forth to those sites. And it's a little bit different from one province to the other, depending if it's rural or urban and where the schools are dispersed. But it is on an orderly basis organized by the education departments.
Dr. Crisp, final question to you. Is there going to be more of a focus on teachers in Gauteng, considering just how bad the numbers are here? Final question to you.
Yeah, Gareth, thanks. So, look, every province has got the same concerns. Gauteng is obviously a massive concern for us because the epidemic has really grown dramatically here. So we hope that they are able to get as many as possible of those teachers to these vaccination sites and vaccinated as quickly as possible. But the same will apply to other provinces where the epidemic hasn't really got going as fast. And hopefully this is just one more thing that we can do to have more vaccine in the community as fast as possible.
Doctor, perhaps let me just squeeze this last one in. It just made me think of it now when you spoke about the jabs for the teachers specifically. What happens if a teacher either doesn't want to take the jab or hasn't received the jab as yet because there aren't enough? Will they be allowed to continue to teach?
So I think the policy will be for the education department on whether they continue to teach, but there's no compulsory vaccination in South Africa. So it's not an obligation that they have to be vaccinated, and it's an individual choice.
Well, I always appreciate your time in speaking to us. Dr. Nicholas Crisp from the Health Department, teachers in line to receive their COVID-19 jabs. We'll be watching it very closely for that rollout. My thanks to you, Dr. Crisp.